Hello, I'm Dr. Robin Crouch, and on behalf of Braincore Neurofeedback of New York, I'm really excited you guys have signed up to listen to our presentation. We have some great information for you, not just on neurofeedback, but also some other things that you can help with many neurological conditions and emotional disorders. Before we begin, I just want to share a letter from a parent on someone who had gone through the neurofeedback program. I just felt compelled to send you this email to let you know how well Margaret is doing since school started. Since the neurofeedback ended, there have been no more panic attacks, screaming matches, suicide threats, cutting, or worrying about what the other high school students think about her. For the first time in 22 years, I have now found the joy in being a parent. Between my son's autism and Margaret's temper and anxiety, and all that I have had to deal with because of that, I have never found the joy that other parents talk about. I felt like I was fighting a never-ending war. Now, Margaret is a joy to be around, except for PMS. She's on the A honor roll in many clubs and is enjoying being a varsity cheerleader. She was even able to participate in the recent school pep rally, doing routines with the cheerleaders without a Xanax. Amazing. Thank you for saving our lives. According to the CDC, 1 in 6 children have some sort of developmental disability. That includes things like learning disorders, autism spectrum disorder, ADHD, anxiety, OCD, or any other neurological or emotional disorder. Practically everyone in America has heard of many of these issues, and often it's a topic of conversation amongst parents. However, most people know very little about them. Most people think ADHD is simply hyperactivity, or a child's inability to pay attention in school, or that people with autism are intellectually disabled, or that people with learning disabilities can't learn. Anxious people just overreact, and OCD is about cleanliness. And as most of you know, this is not the case. Children with neurological and emotional challenge, as you may know, struggle in school, whether it's their inability to focus or their hyperactivity and their impulsive behavior, their difficulty processing information, issues relating and socializing, or just that they're fearful. And this really creates problems developing relationships and ultimately affects their self-esteem. They're often made to feel unintelligent or dumb. These child disorders are not a sign of intelligence or of bad parenting for that matter, and all this can really lead to more problems as they get older. One of our patients' mothers told us the other day that her son used to love to get up to go to school in the morning, and once he started having issues paying attention or processing information, he became depressed. He didn't even want to go to school anymore. He felt like he couldn't do it. There's no single test for all these conditions. A doctor can diagnose them with the help of standard guidelines. So basically, they gather information from several sources, including school, caregivers, and parents, anybody who interacts with the child. And then the doctor considered how a child's behavior compares with that of other children the same age. All of these conditions are diagnosed or addressed from a psychosocial perspective, such as behavioral therapy or psychiatric medication, which comes with a whole host of its own problems, which we'll talk about a little bit later. The majority of scientific research tells us that the central feature of neurological and emotional conditions is poor regulation of the brain's arousal state. So basically that means how sleepy or how awake the brain is. And the brain has an optimal zone of performance. We have low arousal or slower processing for things like sleeping, or higher arousal or faster processing for things like reading difficult material. And depending on the circumstances and everyday demands, the brain may move more towards low arousal or high arousal, but a well-regulated brain stays within its optimal zone of performance. The way the brain communicates is through neurons, and these neurons fire, and they can create a lot of electrical activity. And we could actually read that electrical activity through the scalp using an EEG, an electroencephalogram. So once recorded that information, we get wave-like forms on the paper or on the computer. And these are brainwaves. Mental states are associated with specific brainwaves, and each brainwave represents a specific processing speed of the brain, also known as arousal level, like we just talked about. So these brainwaves include delta, theta, alpha, and beta. A healthy regulated brain is able to shift easily between arousal states as the demand arises. So we have low arousal or slower processing with the brainwaves delta and theta. And then we have an idle state of the brain, which is brainwaves like alpha. And then we have higher arousal or faster processing, which is related to brainwaves like beta. A dysregulated brain has a tendency to habitually operate from one of the three arousal states. So somebody who mostly processes from the slower processing, lower arousal, is considered under-aroused. Someone who gets stuck in that idle state of the brain is considered inhibited. And somebody who processes from the faster processing on a regular basis is over-aroused. So what am I saying? A way to understand this is to think of the intensity of a light in a room. So if we have a dimmer switch that controls the light level, we can have every level of light from complete darkness to so bright that you have to cover your eyes, right? So the dimmer switch of arousal in the brain is located in the part of the brain called the thalamus. And like the dimmer switch that adjusts the light levels in the room, the thalamus automatically adjusts the intensity of arousal for the task at hand. So for a restful sleep, the intensity is turned all the way down. And then for reading difficult material, the intensity is going to be turned all the way up, right? So most activities fall between sleep and intense thinking. So in many neurological disorders, the light or the arousal level stays adjusted to one intensity. So let's talk about the case of ADHD. For ADHD, it's stuck to dim. Okay, so now you're thinking, if someone's hyperactive, how is it that they have low arousal levels? Well, what actually is happening is the person is subconsciously trying to wake their brain up. I'll give you another example. We've all driven long distances at night, fighting sleep, right? So what do? We become hyperactive. We turn up the radio, we sing along, we tap to the rhythm of the music, we roll down the windows to do what? To wake ourselves up. This is what happens with the person with ADHD. They're actually doing something to stimulate their brain to wake up. Just to get a glimpse of what it might be like for someone with low arousal is to imagine someone walks into your room in the middle of the night, waking you up from a deep, deep sleep. And then they ask you to balance your checkbook. Obviously, you have the intellect to do the task, but you have the wrong level of arousal. You're half asleep. And this is not the best example. I think the waking up from the sleep is a way better example. But somebody who has faster processing or higher arousal, it's kind of like having every window open on your computer. You can't process the information because there's so much going on. Or even if you're driving a car in a storm where you have the windshield wipers going, the radio on, the kids screaming in the back, where there's just so much information being. With delta theta dysregulation, the brain tends to operate at a slow processing speed, so that dim light, and it's considered to be under-aroused. And studies have shown that delta theta dysregulation may be associated with things like cognitive impairment, impulsivity, hyperactivity, focus and attention issues, ADHD, being socially inappropriate, easily distracted, excessive speech, disorganized, hyper-emotional, traumatic brain injury, things like dementia, learning disorders, autism, or Asperger. And then someone with an alpha dysregulation, the brain tends to operate at an idle processing speed and is considered to be inhibited. And studies have shown that alpha dysregulation may be associated with things like depression, victim mentality, excessive self-concern, passive-aggressive, irritability, avoidance behavior, rumination, anger, self-deprecation, agitation, fibromyalgia, and withdrawal behaviors. With beta dysregulation, the brain tends to operate at a fast processing speed and is considered to be over-aroused. And studies have shown that beta dysregulation may be associated with things like anxiety, OCD, headaches, insomnia, obsessive thinking, excessive rationalization, poor emotional self-awareness, panic attacks, worry, chronic pain, hypervigilance, dislike of change, and restlessness. Brainwave imbalance or neurological dysregulation may be caused by variations in brain structure, drugs, toxins, poor nutrition, nervous system interference, trauma, stress, whether it be physical and emotional. And all of these things could have happened in utero, it could happen as an infant, or later on in life as well. So, the majority of treatment for these neurological and emotional disorders is psychoactive drugs. And there are drugs for anxiety, there's drugs for ADHD, and basically what the drugs do is they turn up the light or they turn down the light. And I'm not saying that it's wrong to use medication because oftentimes it's the only option. But I think that it's important to be aware of the fact that there are many side effects to these medications. Many times these medications can cause things like decreased appetite or weight loss, sleep problems, headaches, jitteriness, social withdrawal, stomach aches, tics. And sometimes medications can cause more serious side effects. For instance, some stimulants are associated with an increased risk of cardiovascular problems. And actually, the FDA recommends that any child put on stimulants have a full cardiovascular workup. Medications can also exacerbate psychiatric conditions like depression or anxiety, the very things that they're trying to treat. Medications can trigger or exacerbate symptoms of hostility, aggression, anxiety, depression, and paranoia. People with a history of suicide, depression, or bipolar disorders are at a particularly high risk and should be carefully monitored when taking these medications. Medication abuse is a growing problem, particularly among teens and young adults. College students take them for a boost when cramming for exam or pulling all-nighters, or weight loss properties, or just to get high, for example, with a Xanax. So if your child is taking any kind of medication, make sure that they're not sharing their pills or selling their pills. We know scientifically that the medication doesn't fix the problem. It either speeds up the brainwave activity or slows down the brainwave activity. And it's only a temporary treatment. So we remove the medication and we're back to where we started. So not only does it not fix the problem, but it can come along with many side effects, and we really don't know the consequences of long-term use of these medications in children. So how can we turn the dimmer switch of the brain up or down? Food is actually fuel for the brain and the body. So if we could remove the chemicals from yours and your children's food, you'd be giving them a much greater chance to thrive. Processed food and packaged food comes with tons of chemicals. Try sticking to whole foods. I know sometimes it's difficult, but if you get 80–90% of good clean food into your child, their chances for success are much greater. There are many, many programs out there, from the specific carbohydrate diet to the Feingold diet, gluten-free, dairy-free. You don't have to do it all at once. You could start slow by just taking out the chemicals and the artificial flavors out of your kids' food and then move on from there. People are always asking me about food labels and what we should know about them. And the truth of the matter is, we really shouldn't be eating food with labels. Really try to stick to eating whole food. Lotions, potions, cleaners are all filled with toxic chemicals that can act as neurotoxins in the brain. If you can transition into using natural cleaning supplies and natural shampoos and conditioners, it will greatly reduce the toxic load on your child's brain and body, and yours as well. There are tons of natural products out there, and there are many ways you can actually make your own cleaning supplies and body products. Exercise and movement are essential for the developing brain. Get them away from the TV and video games. Exercise stimulates part of the brain called the cerebellum, and this in turn stimulates the frontal lobe of the brain, which is responsible for attention and impulse control. When children sit in front of their TV, their brain actually begins to slow down, lowering their arousal levels. Even the most exciting television lulls the mind into slow processing. It turns down that light. The reason children who normally can't sit still and pay attention seem to be so focused on the TV or the video game, it's because they're lulled into a hypnotic state. The reason we've created this presentation is to teach you about what Braincore Neurofeedback is and how it can help with many neurological and emotional disorders. Neurofeedback is a training procedure designed to bring balance, harmony, and regulation to the brain. Neurofeedback is painless, drugless, and non-invasive. I know this presentation isn't all about ADHD, but I thought it was important for everybody to see this, that in October 2013, the American Academy of Pediatrics approved neurofeedback as a level 1 best support for the treatment of behavioral symptoms associated with ADHD, meeting the highest standards to the appraisal of psychosocial interventions. What is neurofeedback used for? Over 40 years of peer-reviewed university-based research has demonstrated the efficacy of neurofeedback in addressing many neurological conditions, most of the ones that we spoke of today and others as well. Braincore neurofeedback begins with a QEEG evaluation, an electroencephalogram. The QEEG assessment is a tool designed to objectively and scientifically evaluate a person's arousal levels and brainwave patterns. Electrical activity from 12 different areas of the brain are recorded and compared to a normative database, meaning people who reported no symptoms, and then a brain map is generated. And this is what the brain map looks like. It shows us the four most dysregulated areas in the upper left-hand corner, and whether the lights are too dim or too bright. So you could see to the right there are meters that show the different brainwave dysregulation patterns. Then at the bottom, the left-hand column, the CEC, is what the patient or the parent fills out based on the child's symptoms. And then the right side is actually the probability that the person is experiencing that symptom. The brain map provides us with information required to perform the neurofeedback training. It's based on whatever the current research is and other people with similar maps who have gone through a treatment protocol with positive results. So once we figure out what part of the brain we're going to work on, based on the map, the patients are hooked up to the computer with wires and sensors, and the computer reads their brain waves. It's important to note that these sensors are not putting any electrical current into the brain. They're simply acting as antenna to capture the electrical currents coming off the brain. Information about these brain waves are displayed on the doctor's monitor. And here we see a still image of the doctor's monitor identifying the parameters of certain brain waves being produced by the patient in real time. The feedback appears in the form of a game, a movie, or a sound, and in this instance there are puzzles. And while the patient is lying there and relaxing watching a movie, for example, the minute they shift their brain from slower processing to a faster processing, meaning going from that dim light to turning up the light, their brain gets rewarded with the movie playing brightly. And the minute their brain begins moving away from that faster processing back into the slower processing, the movie goes dark. So the brain learns through operant conditioning. If you remember Pavlov's dog, the pressing the lever, getting rewarded with the food, that's operant conditioning. So the brain learns through operant conditioning to keep the screen bright. And this in turn trains the brain to create new connections. And through what's called neuroplasticity, it trains the brain to become more balanced. When you have information on what your brain waves are doing, your brain can use that information to change how it works. Once we learn something, it becomes a permanent part of our behavior, just like learning how to ride a bike. If I put you on a bike 20 years after you learn how to ride, and I push you down a hill, even if you hadn't ridden a bike in 20 years, you'll pretty quickly remember how to ride, and you'll have the ability to prevent yourself from falling. It's the same way with neurofeedback. If you learn how to operate your brain more efficiently with neurofeedback, when you go out into the real world where there's a real demand on it, your brain will respond with its most organized pattern of processing, which is what you learned with the neurofeedback. Follow-up studies in neurofeedback show that the effects continue for up to 30 years or longer. How long does it take to get results? Well, trainees typically come in for 30 to 40 sessions of training. Some people need more, depending on the severity of the case. It's a minimum of twice a week, and each session is about 30 minutes long. And most people typically begin to see changes in about 8 sessions. Sometimes it takes us a little longer to get some changes. So like I said before, neurofeedback is based in over 40 years of clinical research proving its efficacy. For the past 40 years, neurofeedback has been studied in research labs at prominent universities throughout the world. Universities such as UCLA, University of Tennessee, University of South Carolina, Utah, have all participated in research studies that have proven its efficacy. There are some great books out there. One of our favorites is Symphony in the Brain. Another one is Healing Young Brains. I'm sure at this point you have some questions, and at the end of the presentation, I'm going to give you some phone numbers you can call the closest office to where you are. So I want to thank you for taking the time to listen to this presentation. I just want to give you one more story about a patient that we had in our office. We'll call her Lucy. Lucy came to us. She was a referral from another patient who got some great results. And Lucy and her parents were at wit's end. She was diagnosed with ADHD, OCD, oppositional defiant disorder. She had severe anxiety. This kid was pretty much a mess. She was in one school and she actually had, gotten kicked out of the classroom. They said that she couldn't be there anymore. So the parents decided to move into the grandparents' house so they could switch her to another school in the same district. And same problems were arising, and so she came to us and she went through a course of the neurofeedback, and we saw some changes. Her anxiety was a little bit better, but there really wasn't that much change. So we thought, okay, this is the one that got away. And then a couple of weeks later, after we decided to take a break, parents called and said that they couldn't believe it. Lucy was doing amazing. Her anxiety was gone. She was able to sit and focus. She wasn't oppositional anymore. She actually had some play dates that she had people come over to hang out with her. And they had a teacher conference, and the teacher said, "Oh, I'm so glad you decided to put Lucy on medication," wherein they actually didn't. So I just wanted to share with you a little bit of, how life changing this actually can be for many people.